I'd like to welcome to the stage Dr. Mukesh Haikerwal AO, the Head of Clinical Leadership and Engagement and the National Clinical Leader at the National eHealth Transition Authority, NEHTA, a practising GP, former Head of the Federal AMA and a Professor in the School of Medicine at Flinders Uni. Please welcome Mukesh.
Thank you very much and good morning, and thank you for the opportunity to come and speak to you today. As is customary, I too would like to acknowledge the traditional owners of the land in which we meet and pay my respects to elders here past and present. I was sitting there thinking, how am I going to follow that? I mean, this is a world icon talking about something I didn't know he was going to talk about e-health. So it's actually made those echelons of world policy. I do have another role as chair of the World Medical Association, and we have interactions with the World Health Organization. And actually in our audience today, we're very lucky to have the Secretary of the Health Department federally, Jane Halton, PSM, who was formerly the chair of the World Health Association, which is the governing body of the WHO. So many of the things that the Archbishop was talking about in terms of the Millennium Development Goals, MDGs, he talked about, they are United Nations policy. The other aspect that the WHO and the UN are working on is something called the social determinants of health. So health is over and above what health is about the healthcare you deliver and healthcare you receive, but much more about the way in which health is dependent on other aspects of your life, from how before birth, through birth, to how you're raised, to what you eat, work, all those aspects. So they're all parts of what we now know as the health agenda. And the other part, of course, that has come much more to the fore is a whole international way of dealing with chronic disease management. We call it CDM here, they call it the non-communicable diseases in that international forum. So as I ponder the words of the Archbishop, I was thinking what words, we were actually thinking, over the course of the last few days, some words of our own. And words around this agenda are really about justice. In other words, how do you get justice in terms of healthcare for the people of the world, and in our case, the people in Australia. And also the fact that it's not just about technology that we're talking. It's actually about health and healthcare. It's about healthcare services and healthcare service delivery. There is a very strong tradition of healthcare delivery in Australia. The tradition is linked back to the roots in the old world, if you like, in Britain. And I did speak about this a few weeks ago when we were looking at many of the aspects of what's going on in e-health. We saw yesterday the huge development in the use of technology in the healthcare sector, IT, which is e-health, when our team talked about where we've got to with PCEHR, the Personally Controlled Electronic Health Record. We heard about the many tiers of development we've seen, and that's something that is there to be celebrated. And so the demonstration we saw yesterday around the build for PCEHR really is predicated on a lot of good work. But I couldn't stop but make the point that the tradition that we have, and when I think about where I sit as a medical practitioner, and I think into my room as I look across to the walls where there's a couple of certificates, there's one that dates back to 1505 from the Royal College of Surgeons of Edinburgh, where I have a diploma. And it reminds me that, we've come a long way since then. We do a lot of things, but actually it's based on very good, solid clinical method. And what we're doing with what we're doing is not replacing it, but enhancing it. What we're doing is making sure we can support the way in which we do health and do health care. If you look at the way in which we're rolling out e-health in Australia, the great difference, the point of difference, if you like, that we have in our rollout is, I'd say, twofold. One is there's a significant clinical input into that, and we've learned many lessons from our partners and collaborators around the world about where things didn't work for them because they didn't bring in the clinical input early. And the second part is about being patient-controlled. And that's a very unique notion in many ways in this build. And if we do this work properly as we are, if we do get people's care more connected, if we do get the care more joined up, we actually do that healthcare better, and the net result is better value for money. So it's about health effectiveness as well as health cost savings. By doing that, you do improve the health of the nation, and the words that Archbishop talked about, health and wealth being interrelated, is really quite important. It's a significant message that I certainly take to many people when I have the opportunity, that actually health is not an added extra, it's intrinsic. People actually value it, and if you have got a well set up healthcare system to look after people when they are unwell and can look after them into health, it's actually a economic boost to the society, increases the productivity of the society. And I think they're the things that are being talked about. So where we're going with this agenda right now is all full steam ahead, heading towards the 1st of July. And I just want to flag a couple of things that are potential causes for concern. I don't think we should wring our hands and worry excessively about it, but we should understand that if we don't address a couple of these major issues, we'll be in trouble. And that is making sure that the settings we get make people who take up this technology feel part of the system, feel this not a bitter pill, but something that they actually want to be participating in, something that they actually have some part of, but also helped through, cajoled, if you like, to make this change. And so having a whole heap of legislation and sanctions and things that make it unpalatable are a concern. As we heard yesterday, concerns around medical legal issues are an issue too, and we certainly are continuing to address those. I want to wind up by saying a few things about the way in which we do our work. And I was sent a very interesting paper in the last few days around how people react in times of stress. And we all know that when we feel threat, we have this flight or fight way of doing things. This works not just physically, but also in the brain. And for those who are not necessarily from my sector, it's called an amygdala hijack. So where the thinking part of the brain is switched off, because you're all just thinking about getting through the state, and so that state of panic means you don't think straight. And it's important to understand that the brain also can shut down if we are in that state of threat, and to try and either ourselves get out of that state of threat, but also the people around us who are mentoring us through this process or leading us through this process understand that as well, and the way in which we then deal with each other in times of extreme stress, in times of extreme times of having to deliver in a certain length of time, is to stop and allow people out of that pressure cooker to think a bit more clearly, so that they actually then do what we do best as human beings. As human beings, we communicate. As human beings, we think, we collaborate, and we innovate. And at the end of the day, when we succeed, we celebrate. But to allow that, we need to take the brains off. Sorry, not the brains, probably are off. Take the brakes off the brains, which is stopping us from thinking and allowing us to become much more human again, to stop and think and breathe, and at the end of the day, celebrate what we're doing. So what we have here with this agenda, with the people in the room, the people around this agenda, and stellar leaders around, including, I now understand, Archbishop Desmond Tutu, we can see a way that others are walking with us in our shoes, in our footsteps, and carrying us along that journey, so we can actually get to where we need to be, which is a joined-up healthcare system which promotes wellness and joy. Thank you very much.